Welcome back, everyone. While we wait for people to log on, I would just like to welcome the panelists and the facilitator, Lisa Morgan, technical specialist at the ICII in Switzerland, to the last session of today. Today is day 4 with the overarching topic, digitization, facilitating inclusive insurance. We will be talking in this session about InsurTech for inclusive insurance. So thank you very much for joining. And before we start, just a quick walk through the housekeeping. Most of you have seen that already. Please mute yourself unless you're speaking. We have Spanish interpretation available. If you click on the globe sign, you can choose the language channel. The session is being recorded and will be made available on the conference website. Please use the Q&A feature to ask questions. And for any technical issues, please chat with the MIN executive team. Again, a very warm welcome to all of you around the world. Good morning, good afternoon, good evening to everyone. Thank you to you, Lisa, for facilitating this panel, for putting that together. And I hand over the microphone to you.
Brilliant. Thank you so much, Dirk. I'm just going to share my screen. So hopefully, give me the thumbs up. Hopefully you should see my screen. Okay. Great. So a very warm welcome to our session on InsurTech for inclusive insurance. My name is Lisa Morgan. I'm a technical specialist at the ILO's Impact Insurance Facility and will be facilitating the session today. As an actuary, having worked in insurance for over 2 decades, I'm particularly interested in topics related to data and technology, and especially how this can help low income and excluded populations access affordable and quality insurance. And so I'm very excited to welcome an excellent and diverse panel of speakers today. We will hear from an expert consultant on InsurTech, the innovation arm of a traditional insurer, an inclusive distributor using blockchain, and a digital health provider which, amongst other things, matches the underutilized capacity of female doctors to the unmet need of health consumers in Pakistan. So let me repeat 3 important aspects of inclusive insurance: accessibility, affordability, and quality. Technology certainly has the potential to improve all of these things. Digitized distribution can improve accessibility. Automation, for example, can minimize expenses, making products more affordable. And access to qualified doctors via telemedicine can improve the quality of the insurance benefits. Technology can be a game changer, but we have also seen that technology cannot solve all issues. For example, we heard Catherine at the Microinsurance Network earlier in the week explain that access to technology is not equal for men and women. And this could actually widen the gender protection gap. Many of the attendees to the conference over the years will also be familiar with the notion that a hybrid approach using technology, but not completely losing the human touch, is what customers prefer. So keeping client-centric using a human-centered design, for example, is therefore vital when developing technology-driven solutions. So for those of you who may not know the ILO's Impact Insurance Facility very well, I just want to say a few words. We have been in operation since 2008 and have a vast collection of knowledge products that can be found on our website. Azia is going to put the link to our website into the chat now. We are leaders in stimulating innovation and conducting research on inclusive insurance, knowledge and capacity building, and inclusive insurance market development. So if you go to that website link and you search under technology, you will find quite a lot of information that comes up. So I invite you to do so. It's got lots of information from over the last decade and more. So our mission at the facility is to enable the insurance sector, governments and their partners to realize the potential of insurance for social and economic development. And keeping up to date with developments in InsurTech is therefore really important to us. And so at the end of last year, we conducted a survey to see which InsurTech is being used by inclusive insurers. And this is the first time we are sharing some of the results. Watch this space because we will be publishing some related thought leadership pieces next year. So given the reasons why technology could potentially solve many of the problems that inclusive insurers face, as well as the obvious benefits of automation during pandemics, such as COVID, we were curious to find out who was using which technology and for which purposes. There were 93 insurers and insurtech providers that participated in our survey, collectively operating in all regions of the world, but with a strong contingency working in Africa and Asia and the Pacific. The participants offered all lines of inclusive insurance. Note that participants could have selected more than one type of cover. And the participants were also a mix of organizations, with around half bringing over $1 million of USD of annual revenue in 2019. So before I show you more results from our survey, I'm curious about you, our audience, and would like you to, Asia is going to copy this menti.com website into the chat, and I would like you to open your browser, and I'm going to ask you a question. So I would like you to tell us about the different types of insurtech that you've come across. So if you go into www.menti.com and use the code that should also be in your chat and start typing in words, they should start coming up on the screen. And I've been quite generous because each person should be able to put in 10 or so words. So yeah, look in the chat, and if you just follow the menti.com. Okay, so here I'm talking about insurtech rather than types of insurance. So if you think about the technology, so I'll give you a clue, blockchain, for example. So if you can start typing in the types of technology that inclusive insurers might use, great, we've got one blockchain. If you can just start typing in, we've got 79 people on this call, so hopefully we'll get a few more answers. Okay. Again, not to confuse the type of insurance with the type of technology. We're looking at technology. So I'm just going to give you another 30 seconds to start typing in. Think about, okay, like we've got mobile wallets, blockchains coming up. What else have you heard about? Okay, I think I've said blockchain too many times. But okay, so let's keep going. All right, we've got more words coming up. Okay, really interesting. So while that keeps changing, we now have 79 people joining. We can see that blockchain, telemedicine, smartphone, mobile, SaaS, Excel sheets, digital financial education, digital claims, mobile wallets. Okay, there's some really interesting things coming up here. Okay, so let's go back to our survey, and let me show you. All right, so we asked our participants to tell us off this list of things, which types of insurtech they were using. And here you can see what's really interesting is digitization. Around 80% of our participants said that they were using digitization. Then came apps, social media, cloud-based platforms. And then we were interested to see chatbots, machine learning, intelligent automation, IoT, which is the Internet of Things, come up next, followed by blockchain. And then if you go all the way down to the bottom, you'll see that deep learning and gamification were not widely used. Okay, so now let's try that again. Now you know how menti.com works. I'm going to go back to menti.com, and I'm going to ask you another question. So great, there is this technology that exists there, but what are inclusive insurers actually using this for? So this is the question. The question is, what do you think is the most useful application of insurtech in inclusive insurance? So again, if you type in menti.com, you put in that code, and then start thinking, what for what purpose would that technology be really useful when it comes to inclusive insurance? So again, I'm hoping that we'll, okay. So I'm going to give you just a couple of seconds to start putting in the answers, and then we'll see what comes up. Okay, so for those of you who don't know Menti.com, if something comes up more than once, the size of the font gets bigger. So this is a word cloud. All right, I'm going to give you a few more seconds. All right, great. So this is really interesting. So claims processing is coming up as the biggest, or payments. I'll just change place. Pricing, client education, underwriting. Okay, it looks like we've got pretty much all of the value chain there. So I'm going to go back to the slides now. Okay, so from our survey, we ranked the uses of InsurTech of the participating inclusive insurers, and these were the top 5. In first place was claims management, which many of you put into your Menti, followed by distribution, which is not surprising, especially with inclusive insurance. Then enrollment, renewal policy and admin, followed by education, and in 5th place, premium collection. So with that, I would now like to introduce our first speaker, Demetrius Velmachos. So I'm going to come out of my slides and a moment. So let me tell you a little bit about Demetrius. Demetrius is an actuary with extensive and diverse international experience in leadership roles, particularly in the insurance industry. He has held chief actuary, general manager, partner, and senior advisor positions for market-leading organizations. With over 20 years of experience, he has led the development of innovative solutions and awarded applications in such areas as underwriting, legacy portfolio management, and product design. Demetrius has initiated strategic transformations, led diverse teams across the globe, established new ventures, and remains active in industry forums, academia, and as a mentor to startups. In recent years, he has focused on investment opportunities within the insurance industry and the utilization of advances in the data ecosystems, digitalization, and in technology. He now provides thought leadership and advice for insurance organizations, public and private institutions, and consulting practices. So a very warm welcome to Demetrius.
Hello, everyone, and I hope you hear me well and you see me well. If I have some connection issues, Lisa, like before, let me know. Thank you very much for the invitation, first of all, and I saw also the replies in Menti, and I think the participants are already, I think, quite familiar with the discussion. So I'm going to start, first of all, I don't know, Lisa, if you have any particular question that you want me to begin with, or
I do have a few. So let's start out with this question. So as we know, there's a lot of technology out there looking for opportunities to disrupt the insurance industry. Some of it's already being used, while others are only being piloted. So, I mean, Demetrius, what trends do you see in InsurTech?
Okay, so before I go to InsurTech, let me just start with technology, and because this is basically what also drives InsurTech. So I'm going to start by saying that we live during the 4th industrial revolution, and what that really means is that means connectivity. That means we are living in a very data-driven world, in a connected world. We live in a world that we want to be as automated as possible, and not just automated. We want it to be in an intelligent way automated, and that basically means to utilize the digital technologies. And we are in a state where we are in a constant transformation, a digital transformation. Actually, the platform we are currently using to communicate, Zoom, is evidence of that. And I just want to say that the pandemic and COVID has actually enhanced and accelerated this process of digitization. So if you look at the platform we are using, just before the pandemic, there were 10 million users. And the last time I checked, and that was actually just a few months after the pandemic hit us, it went 30 times more. And Zoom is one of the companies that at the moment, it has a market cap of more than 80 billion. So things are changing actually, sometimes fast and sometimes are changing very, very fast. The technology which are underlying this technological and industrial revolution, technologies like digital technologies like artificial intelligence, blockchain that a lot of people mentioned, are actually, we see that there is more and more development, there is more and more trust. We see a lot of investment. The investment is not slowing down at all. We see that the investment in AI is picking up, and it was already a lot. A lot of people have talked about hype. A lot of people talked about the potential of AI winter. But the consensus is that we're not going to have an artificial intelligence winter again. And if you take China, for example, which is a leading country in artificial intelligence, we will see that the last year, I think they invested in more than 150,000 startups in artificial intelligence. We're talking about huge changes at the moment. If you look at blockchain, that I saw a lot of people mention, if you see the transactions that are happening at the moment with Ethereum, it's as many as the transactions that are happening with Visa. If you're looking at crypto, we're talking about a market which is measured in trillions. So we're living in a world that we are not going back. This is where we are. There is more to come. And I think in the next years, we will see a lot of changes and a lot of innovation. I will connect that now with InsurTech. And I will say that...
if I can continue, yes, please.
Go on.
I was going to ask another question, but I don't know if you finished with that one.
Yeah, just very quickly to say that if you look at InsurTech, the theme on that is that technology is now interconnected with financial services. And financial services is technology. And I was just going to use 2-3 examples very quickly. And I want to use China as an example because China is a very exciting region. What is happening there is unmatched. And it's an exciting region because although it's a superpower, there are segments in China that have the characteristics of the target populations that we are investigating in this forum. So the example that I was going to use is Ping An, which is probably the most, one of the biggest insurers in the world, and in terms of value, probably the one with the biggest valuation at the moment. And it is becoming a technology conglomerate with thousands of data scientists, huge investment in technology, AI very much underpinning everything they're trying to do. And the opposite is Ant Group. For the I don't know if you have followed basically the developments of Ant Group, which is Alipay, which is a spin-off from Alibaba, which was a technology company that now becomes a financial services company with digital wallets, etc. And the fascinating with this is that we were anticipating an IPO from Ant Group of the magnitude of more than 30 billion, which is more than what was achieved from the biggest organization so far that IPO. And last thing on this, Lisa, I spoke about China, but we see the same thing everywhere else. We saw Lemonade, we saw companies like Oscar that were digital insurers, and there is market capitalizations and valuations of many billions. So that's the trend we see at the moment.
Great, that's really interesting. And how are these trends applicable to inclusive insurers wanting to serve the emerging consumer? Do you think that these solutions could revolutionize the inclusive impact or impact insurance industry?
Yes, you mentioned before in your introduction that what do customers seek? They seek from the insurance industry, they seek trust, they seek easy, and especially the customers of developing regions and developing economies. They look easiness, they look trust, and they look affordability. And in many of the developing, in many of the countries in the developing regions, the population has all the characteristics that are positives for growth of the insurance industry. We see young populations. We see actually a very good penetration in mobile technology. And we see also that the protection gap is even higher there. So if someone needs solutions, it's these regions. So the digital capabilities can play a role there, and they can satisfy these demands because, as some academics have mentioned, a digital asset is instant, is perfect, and it is free. Once you design it, it doesn't cost anymore. So the technology can play a huge role when it comes to giving solutions to those markets. But I have to say also this, I want to put the caveat that technology is not a silver bullet, and competition by itself cannot make the difference.
Great, thank you. So can you, just going on from that, can you describe some of the more impactful InsurTech solutions that you've seen and what problems across the value chain they might solve for inclusive insurance? And in particular, can you tell us of an example where the impact has been significant?
There are thousands of InsurTechs, and I actually had the chance to work with a few, and they were quite exciting places to see the business model. And actually, one of them is one of these multi-billion unicorns at the moment, and I had the chance to work with them quite extensively. But for me, the characteristics are more or less the same, and I think they were captured also by the participants and by you, by the research you did in ILO. So the common theme is the following. InsurTechs are looking to disrupt the value chain, every point in the value chain, and they're doing that basically with the following methodology. They focus on a niche. They're trying to solve a very particular problem. They don't try to become a composite insurer. And they're looking at the value chain. Very importantly, they look at the underwriting, at claims handling. Distribution is a very, very big theme in InsurTechs. And the technologies that underpin that are digital technologies is machine learning, is advanced analytics. It's very much leveraging the data ecosystem. So basically, the differentiation for many of them comes by using proprietary data and creating margins in the propositions that otherwise an incumbent wouldn't be able to deliver. So this is, let's say, the common theme. I don't want to mention specific names. I'm not affiliated with any of them. There are many successful examples. However, what I will say is that the ones that, in my opinion, have been mostly impacted, that mostly have impacted, are the ones that focused on underwriting and on distribution issues, because these are two very, as an actuary, you can understand that these are two very difficult issues to tackle. Some of them that were very successful via applying models and partnering with different marketplaces were actually able not just to attract customers, but to attract new customers in insurance, which for me is very important. And when it comes to answering also the last part of your question of what is particularly impactful for inclusive insurance, I wish I would say in this discussion that it's a solution that is showing artificial intelligence or something in deep learning. Unfortunately, I can't. I mean, maybe if you invite me in a few years' time, maybe I will be able to say that. But what I found very exciting and very impactful were out-of-the-box simple solutions like the ones that they applied in Africa and in India in terms of mobile technology. And in essence, using a very simple technology to create digital wallets. So the first digital wallets were those. And also, I like very much innovative solutions like the ones that have been created by the insurance in the beginning, like parametric insurance. And I do know the criticism about that. I do know that it doesn't solve every problem, but it is one example of how insurance can be both affordable and easy. And last but not least, especially for developing regions, I really liked, and I had the chance to work with some applications. I really like the telemedicine applications. I think they really add value if they are designed properly.
Fantastic. Thank you, Demetrius. So it seems like there's this trend of maybe some of the conventional insurers really becoming extremely digital, and there's some really exciting things happening. But at the same time, there's still many insurers that are paper-based and not really using, much in the way of digitalization that is out there. So just very quickly, if you could, if you had to give some advice to our listeners today on how they could go about improving their offering, using some of the latest insurtech, what would that piece of advice be?
So some is maybe a little bit generic, some is specific. What I would say is, first of all, focus on the problem you're trying to solve, understand it really, really well. Don't just look at the technology that don't try to find a problem to apply some technology. Find a problem which will have impact, find some big idea, try to understand how it really, really works. And ideally be out of the box when it comes to solution. If not, then at least be simple. That's the first advice. The second one is use digital technologies because of the reasons that we described before. And try to leverage the digital capabilities. However, I understand also that there are limitations. Understand also that for digital technologies to operate and to be able to scale and create a sustainable solution, you need to deal with the infrastructure. So you need to create an operating platform that works properly. The third thing I would say is that do not underestimate experimentation. And this is where a lot of incumbents get it wrong and a lot of insurtechs get it right. Use innovation loops. Fail fast. Use innovation loops in order to create a compelling value proposition, in order to create a compelling product. And last but not least, insurance is not an exercise for the laboratory. Insurance, in order to create proper insurance solutions, you need to engage with a wider ecosystem. And the wider ecosystem includes government, includes policymakers, includes institutions like the one you are working or other institutions. It includes other entrepreneurs. It includes technology companies. And it includes also the incumbents. You need to engage the ecosystem in order to create something that will have an impact on the society.
That's brilliant. Thank you so much, Demetrius, for your thought-provoking and valuable insights. And we'll also have hopefully some time for Q&A at the end, so please stick around. I see the chat's gone crazy, but yeah, we'll carry on after the end of the presentation. So thank you so much. I would now like to introduce our second speaker, Michiel Berend. And let me tell you a little bit about Michiel. So Michiel is the Chief Inclusive Officer at EtherRisk, where he oversees activity pertaining to the development of the organization's inclusive insurance offering. He first began his career in financial services as an underwriter with Dutch insurance company Interpolis. And through this endeavor, Michiel was introduced to microinsurance and its framework for the protection of low-income populations. Michiel followed this progressive work to India, where he supported a large microfinance organization in its quest for suitable insurance technology. He then resigned from the corporate world in pursuit of social good in India, where he established a knowledge center for microinsurance. Michiel specializes in consultancy with a focus on insurance and technologies in emerging economies, and has worked on projects spanning several emerging markets in Asia, Latin America, and Africa. His role as Chief Inclusive Officer at ICII, Michiel assists in the provision of better financial service access for those who need it most. As director, since 2020, Michiel also oversees ICII Impact BV, which is the entity in the ICII ecosystem dedicated to projects in sustainable development, inclusive insurance, and agricultural solutions. So Michiel, a very warm welcome, and over to you.
Thank you. Thank you very much for the introduction, Lisa, and also thank you very much for inviting me in this panel today. As you said, my name is Michiel Berende, CIO at ICII, and it's a real honor to be here. And I'm also very happy to see some familiar faces amongst the participants. A special hello to you. I hope soon we will be able to meet each other in person. That would be great. I've got a few topics I'd like to discuss during my session. I will start with an explanation, short explanation about the ICII ecosystem, as we call it. Then I will dive briefly into blockchain technology itself. And then I will speak about the Acre Africa project that we're currently working on. And then I will end up with the future of decentralized insurance. And I think that also connects with the discussion that we just had between the two of you. So let's start. And let's see. Okay, so the ICII decentralized insurance ecosystem. But the ICII ecosystem consists out of a number of entities, and we're all together. Some entities are in Germany, some are in Switzerland, and also in the Netherlands. But together we have developed a decentralized open source insurance platform on the Ethereum blockchain. And this platform we call the Generic Insurance Framework, or in short, the GIF. And this platform has the purpose to digitize insurance products. And that could be any kinds of insurance products, but the best use case of blockchain technology and insurance is parametric insurance products. With this platform, we are able to automate the complete life cycle of an insurance product. And we do that through so-called smart contracts, and I'll dive into that in the next slides. So because of the automation of this that the platform makes possible, we are able to reduce the operational cost of insurance, while at the same time also drastically increase the speed of transactions, and at the same time improve transparency thanks to blockchain technology. So together with my colleague Jan Stockhausen, we had ICII Impact BV, and we completely focus on inclusive insurance, and also are running the project in Africa with Acre Africa. So blockchain technology and this weird internet money. Blockchain technology sometimes is also called a distributed ledger technology. And that means that blockchain technology is a decentralized digital database, or sometimes also called a ledger, and that has information within the database that is not stored in one central point, but at several points simultaneously. And once this information is at these various points, it means that there is consensus about the data that is displayed over there. So everybody sees exactly the same data. And therefore also they know that the data is correct. So, and once the data, for example, transaction is on chain, it can no longer be changed without consensus amongst those same participants in a blockchain. And this makes it possible that an intermediary is not required anymore. So where you normally had a bank that was verifying the various transactions, this is now done automatically. And thanks to that technology, it becomes now possible to program assets or money, and that we call smart contracts. And the application of using smart contracts the best example, one of the great examples of applying smart contracts is also a parametric and weather index insurance. As you see in the image over here, we could, for example, create a smart contract that automatically receives weather data from satellites or from sensors. And these smart contracts can also then affect payments in real time without a need for human interaction. And our generic insurance framework contains a whole set of smart contracts that together cover the complete life cycle of an insurance policy. So we have, for example, a smart contract that monitors incoming premium payments. And when this payment is done, then automatically a policy will be issued. We could also use a smart contract that is monitoring the capital ratios in the risk pool. And also we have the smart contracts that execute payments. So again, because of this automation, we can increase the speed of transactions a lot. And we can also reduce the transaction costs of policy issuance and claim processing by, and that is something that has been researched also by an organization that's working with us, the Climate Finance Lab, that we can reduce the costs up to 40%. And also, what is also a fact, we have been able to reduce claim cycles in agriculture insurance from 3 to 6 months up to an executed of payments within a week or mid-season payouts. I'll talk about that also in a few moments. So, as I mentioned, we are now working with ICII Africa. ICII Africa is one of the largest agricultural microinsurance service providers in sub-Saharan Africa. In the past years, they have been able to sell 1.7 million insurance policies, and they focused almost entirely on weather index insurance. And through a mutual contact at Wageningen University, ICII Africa was introduced to us, and that was already in 2018. And together we started talking what are your challenges and also what are our challenges. I think our main challenge was to find an organization that was willing to dive into this new groundbreaking technology together with us. We faced an innovation gap, and I think this was also just mentioned. It was very difficult to find parties that really said, okay, let's give it a try. Let's see what this technology does. And it's difficult to see when you speak also to the insurance industry, who has a risk aversion in its DNA, obviously. So also ICII Africa shared some of their challenges with us, and this is also something that you have heard during the week. The adaptation of insurance solutions lag behind. Insurance solutions are in some cases not affordable for smallholder farmers. And there's also little trust in insurance due to the histories of delayed payouts for up to 3 or even 6 months. And we thought that we could help ICII Africa with this. And together we started developing a blockchain business plan. And we made the calculations and what would be required. And then we started also searching for parties who would be willing to invest in such an exercise. And last year in October, we found the support from blockchain giants Chainlink and also the Ethereum Foundation. And they allowed us also to kick off the project in October in 2020. We started with an integration assessment. And we reviewed the existing systems that were used at ICII Africa, and we took a deep dive in the insurance product design. And then we were really certain also that we could actually build a solution for that. And when we had this confidence, we also found other parties that were willing to support our work. And that's also the Decentralized Insurance Foundation. It's a part of the eTrisk ecosystem, Mercy Corps, and also Swiss Development Cooperation. So in January of this year, we started with the development of a minimum viable product. And I think now in the past season, in the long range season in Kenya, we were able to onboard 17,000 policies on our platform. And of course, in terms of millions of farmers that do not have insurance, this is a low number, but in terms of blockchain, this is something that is unheard of. Nobody in the world has been able to onboard these kinds of amounts of insurance policies on chain and also execute the first payouts. So we're very proud of this thing. And I'd like to explain and show you also a little bit more about the parties and the various roles that are involved in this process. So ICII Africa distributes the products that they develop through farm input suppliers and also experienced farmers, which in the communities which ICII calls village champions. A farmer can buy a bag of seeds, and this bag of seed contains a scratch card with a USSD code. And once the farmer plants those seeds, and that's in the field, we are able to capture also the geolocation. Farmer can register the code using SMS on their simple feature phone. The basic insurance premium is already prepaid and included in the price of the bag of the seeds. And top-up payments can be made through M-Pesa, Kenya's mobile money, to increase the cover. So once the insurance contract is active, a smart contract will start autonomously track the weather data that is relevant also to the insurance policy. And the weather data is sourced from ICII satellite data. So the smart contract will also automatically execute a payout through an API that is connected with M-Pesa when the conditions for drought or rainfall are met. And I think being able to execute fast payments, we are able to solve an existential cash flow problem that farmers have when there's such a long delay between the claim and the insurance payout. And as I already mentioned, our solution has now achieved also to reduce the claim cycle for a number of months after the season's end to mid-season payouts. Mid-season payouts, so even before the contract, the insurance contract has ended, the farmer can already receive payments that belong also to the growth phases of their crop. And this is something that is unheard of. I have here a high-level architectural picture of the solution that we have developed in cooperation with ICII Africa. So ICII Africa provides the pricing tables and it has done the actuarial work. We collect then the rainfall data from ICII satellites, and this information is gathered in what we call the contract review engine. So they compare the pricing data with the rainfall data, and if then a payment is to be made, the contract review engine will give a signal. We also collect the customer and payment data through the USSD application. And when we have this information in, we also have a way to communicate and provide farmers information about the product or the status of the product. And then we have decided also to generate a payout schedule so that ICII Africa can decide when exactly a payment is to be made, whether it should be like an individual payment or a payment in batches on certain dates in a week. All right. So let me move to some of the results that we can share also at this moment. Instead of months of idle time, there is now an option of immediate data processing. So these sessions are now an automated process and not a process that requires human involvement. And because of that, we have been able to reduce the number of people on a massive scale And that also gives ICII Africa the option to work on other aspects in the business. We have now made it possible to very easily audit all the work that's happening within the organization, thanks to the complete audit trail that is now on-chain available. And of course, most importantly, farmers receive mid-season payouts. And I think I cannot stress this enough. This is very good. So for the future, I think on the short term, what we are working on right now, the short rain season started now in Kenya. And so we will continue working with ICII Africa on onboarding these farmers. And for that, we are also creating dashboards. What blockchain is making possible, providing a single source of truth. And we want to really show this also to all the stakeholders involved in this process. So that could be to the insurers, the reinsurers, the donor organizations that work with ICII Africa, and of course also the regulator, so that they can see that this is a process that you can automate, that you can trust the information that is available. And for the longer term is that I'm pretty convinced that new forms of risk capital will be made available to cover the risk of smallholder farmers. And I'll talk about that through this slide, which is also my last slide. I think some of you might have heard of DeFi, or decentralized finance. And I'd like to give you a sneak peek in the future for insurance and decentralized finance, or decentralized insurance. Decentralized finance refers to digital peer-to-peer financial services. And what you see happen right now, mostly it's permitting crypto trading, so in cryptocurrencies, but also other financial products are being made available for loans, interest accounts, and other services. And these solutions are built on top of public blockchains like Ethereum. And the creators of these platforms, they are trying to cut out the traditional banks and brokers and make it possible to facilitate faster, cheaper financial transactions all day, every day, at any time, with minimum transaction amounts. There's no paperwork, there's full transparency, and also auditability. And to give you also some numbers, so the decentralized finance industry accelerated in 2020, growing from a volume in the month of December 2019 from 700 million to a volume of 13 billion in December 2020. And this year, the transactions have met a volume of 40 billion. And as you just already mentioned, that the amounts of capitals are now available in the crypto industry, they are in the trillions. So in short, there is a lot of capital available, and this is moving incredibly fast. And it's much more efficient also. The grant and donor capital is involved that is also trying to make inclusive insurance happen. I think what blockchain technology will make possible is also to bring in new investors that are looking to run risks for rewards, willing to be exposed to risks, and decentralized insurance will become the next stop. I'm absolutely convinced about this. I think try to imagine what will happen if even smallholder farmers themselves can invest in the solution and participate in the profits that are made here. It will be a complete game changer. So I recommend you to keep an eye on this space, and it will happen much faster than you expect. And perhaps you should also keep following us at ETHRisk. And I'd like to thank you all for listening to me, and be happy to discuss some questions with you. Thank you very much.
That's brilliant. Thank you so much, Michiel. That was, just so insightful and just so informative. So just back to this point about, investment. Do you believe that blockchain technology will make it possible for non-traditional capital investors to invest in insurance products?
Yes, absolutely. I think, and always, but I've noticed also in our own pursuit in making work happen in the blockchain space, it is also that sorry, I see my presentation has gone.
That's okay.
Okay, no, but blockchain technology is not only about.
Do you need it back, Michael, or do you want to use? Okay.
Yeah,
maybe Asia, if you can put it back up. Or I don't know. Maybe Michael, you were sharing it.
I don't know. That's not a problem. It's not a problem. Okay, well, anyway, I believe that blockchain technology is not only about automating insurance. It is also about handling assets like capital. And I think you and we can also invest ourselves in insurance products through a solution by providing risk capital. And you will be able to earn rewards from premium paid by insurance. And we do not have, by using this new technology, we do not have the limitations of traditional insurance, who actually do the same thing. But they are depending on huge ticket investments, for example, in catastrophe bonds. And now the technology will make it possible to do this also for small investors. And as I already mentioned, also farmers can invest and participate in the profits made. And this is a game changer. This is really going to change the insurance industry.
Fantastic. Thank you so much. We could continue speaking, I think, for another hour at least. But in the interest of time, thank you, Michael. I'm going to move on to our next speaker. So stick around. We'll have time for hopefully a few questions at the end. So let me tell you a bit about me. So Nie Hoyn is our next speaker, and Nie joined Allianz in 2019 as a manager in the platforms and acquisition teams, and looks after emerging markets and insurtech investments such as Bima, SafeBorder, and Pi Insurance, sorry. Prior to Allianz, Nie was with Allianz B2B2C unit, Allianz Partners, since 2014, covering finance, strategy, and digital transformation topics globally. Nie holds double French-German master degrees in financial management from the Université de Paris and Panthéon-Sorbonne and Universitat Hohenheim. I would also like to just tell you a little bit about Allianz X. Not everybody will be familiar, so let me just tell you, Allianz X invests in digital frontrunners in ecosystems relevant to insurance and asset management. In just a few years, its investment budget of around 1 billion euros has grown to a portfolio of more than 25 companies and assets under management of over 1.5 billion euros. Allianz X has counted 7 unicorns amongst its portfolio so far. I hear that at the heart and brains behind it all is a talented team of around 40 people. As one of the pillars of the Allianz Group's digital transformation strategy, Allianz X provides an interface between Allianz companies and the broader digital ecosystem, enabling collaborative partnerships in insurtech, fintech, and beyond. As an investor, Allianz X supports mature digital growth companies to take the next bold leap and reach their full potential. So Nie, over to you.
Thanks so much, Lisa. Hello, everyone. This is Nie. Really nice to be here today. Thanks for having me. I'm happy to introduce you a bit to the world of Allianz X, and also maybe if we flick over to the next slide, I can show you a little bit of the glimpse of our portfolio, like you see here on the left side, and what we invest in, and what are our convictions when it comes to deploy the capital that of €1 billion that Lisa mentioned previously. So if you look at this, our primary focus is from an investment focus perspective is to be a global investor and a primary interface between the Allianz operating entities as well as the digital ecosystem. With ecosystem, because it's such a wide word, we mean, for instance, the Indonesian ecosystem that has been built around Gojek, Haildog, and that you see here on the slide, or the likes. So that leads us to, I think, maybe to the second bullet you see here, which expresses a bit the stage of the companies we invest in, very much in digital growth companies, and that are in a later stage that help us to have a high impact and also greater access to customers as well as to the ecosystem. And to sum up the last 3 ones, I think the way how we work is that we push the frontiers of the current existing insurance ecosystems, because as you know, being a more than 100 years old company might make you a little bit complacent, and we at Allianz X are here to push out that frontier and to catch up with Michelle and the likes who are really using new technology to deploy insurance products and give access of insurance products to customers more easily. So I think that leads us pretty well into the next slide that shows you a little bit more concretely how we do that actually with our portfolio companies. So as an example, today we'll focus as part of the Inclusive Insurance Conference more on the emerging markets investments that I'm looking after, which is, for instance, BIMA, a company that you might be familiar with. That's one of the largest microinsurance and provider that with health services, and that's working together with fintechs to distribute insurance and health services to emerging customers, and that's active both in Asia and in Africa across 9 different markets. And secondly, we'll also speak a little bit about HaloDoc and Gojek that you see here on the right side, an ecosystem that it has been built in the past years in Indonesia. And lastly, we'll also speak a little bit about Safebuda, a company we co-invested together with Gojek and to replicate a similar approach in Uganda as well as in Nigeria. So moving on, perhaps to the next slide. We'll start off with BIMA, and I'd like to give you a little bit of an idea what BIMA is about and how why we invested into BIMA, and last but not least, how we contribute together with this trio to the Inclusive Insurance Alliance that you see here. So for those of you who don't know what BIMA is a microinsurance company, as I just mentioned, that offers healthcare services, that integrates with fintech wallets, and that gives you a seamless experience across these 3 verticals. And we are, at Allianz X, together with our Allianz colleagues that you see at the bottom left here, we provide, as an underwriter, a seamless partnership that contributes insights on low-income insurance solutions, as well as capital via Allianz X that I'm representing today into BIMA. And both together, we work with the GIZ that you might know, the German development agency that works together with us on facilitating the Insurance Alliance. So just to recap, we have 3 components here. We have, first of all, the tech company being BIMA that contributes the technology and the access to customers. It facilitates the access as well as the service delivery to customers. Secondly, we have Allianz operating entities providing insurance solutions as well as capital from Allianz X in order to deliver these products to the customers. And thirdly, we have the regulatory side as well as the development institution side that helps us to engage with insurance regulators and other stakeholders of the whole microinsurance value chain, and that facilitates at the end of the day to deliver microinsurance products. And within that framework, we believe that all the 3 are necessary to deliver a seamless experience to customers, meaning we need tech, we need the regulatory component, and we need the capital / the insurance capacity. And I think that if we go back to what has been said by Lisa Dimitrios at the entrance of the session, is that technology is not self-serving. So with this example, you see very well how this plays out. And just to recap, all of these three components together, they help us to reach more than 46 million emerging consumers, and they help us to transform the microinsurance and health services landscape and the insurance industry. And I think I'll pause here to move over perhaps to a different example coming from the Inclusive Insurance Alliance towards the next slide, where we'll cover a little bit more a different angle, which is the health insurance side. And we will dig a bit deeper and a bit more concrete on one particular example in Indonesia. And as part of that, I'd like to highlight our collaboration between the tech companies that you see here, as well as what we've done with them. Maybe just some of you have already joined session 17 before, that was featured with our colleagues from Allianz Life Indonesia, as well as Halodoc and the GIZ, and that covers a bit of the alliance or of the partnerships that are mentioned here. But happy to give you a bit more a different angle here from an investment perspective, how we work together with our operating entities and our investment companies. So if you look at this slide, we might start from the top here. Our aim of using technology is not self-serving again. So our aim is to reach as many customers as possible, as this increases significantly financial inclusion, as well as improves the health status of our customers and emerging consumers. This is why we engage with all our operating entities, as well as with investments in the space. And that has played out very explicitly and very publicly during the pandemic. And as Demetrius, for instance, pointed out, the pandemic has significantly increased or accelerated the development or the behavior change coming from using more offline solutions to online solutions. However, as we see, as we observe here, both are necessary. If you're looking at the way how we serve emerging consumers, we are never using only online or only offline solutions, but we provide platforms and we invest in platforms that best connect both worlds, the online and offline world. And the perfect example of that is the COVID-19 response that you see here with our portfolio company, Halodoc, which is connecting the offline health services world, being, for instance, hospitals, doctors, and the likes, with patients. And as part of that, we've offered free doctor teleconsultations, as well as COVID testing campaigns. Moving on to vaccinations with Halodoc in Indonesia. And in addition, we've highlighted as part of our Inclusive Insurance Alliance that you've just seen before, also the importance of financial and insurance literacy. And as part of that, you have workshops and trainings offered by our companies as well. And moving on to the second block that you see here, the way how these solution pan out is they are online and offline. They connect both worlds. They are inclusive. They serve the local community. They are products that are accepted by the local community, which is very important when it comes to product design for emerging consumers. Hence why the trio of technology company, insurance provider, and regulatory and development institutions is very important, and that we see that across all partnerships. And moving on from the community, to the platforms that we mentioned, the tech platforms, it's most efficiently from an investor perspective to reach customers via a partnership with large digital platforms like Gojek. This is the reason why we've invested in Gojek and teamed up with our colleagues at Allianz Life Indonesia to give access to quality healthcare solutions for millions of drivers and their families. And you see the same with Allianz Life Indonesia's partnership with Bukalapak, an e-commerce player that offers small ticket insurances via Allianz Life Indonesia. And just to round up these efforts that we've done in Indonesia, this is just merely an example of how comprehensive an ecosystem can be. And maybe just as an outlook, we need tech, we need investors and capital providers, and we need the regulatory part in order to deliver and best serve our emerging consumers. Indonesia is just an example, but we've observed that this combination is the best way for us to attract more investments into the community, and we see that coming, and we're looking forward to more similar projects, as well as to team up with more partners in public-private partnerships as well. Thank you so much for your attention, and feel free to reach out in case you have any questions.
That's great. Thank you, Nii. That was really excellent. I love the idea of, the waste, collecting waste and getting insurance back on the previous slide. I just have one quick question for you before we go on to Asha. Why do you think investors are interested in emerging markets and inclusive insurance aside from the financial returns?
Thank you for the question, Lisa. I think it's very fair. Traditionally, we haven't seen much capital flow in the space in the past, but we have observed significant capital inflows into so-called impact investment platforms, as well as with the rise of ESG, like ESG platforms. We've observed also a lot of capital moving into that space. I think an example is the 500 million investment or partnership with an impact investor who is also a co-investor with us in Bima Leapfrog from Temasek, one of the largest sovereign wealth funds in the world. And I think that's just a testament that creating impact and getting profits at the same time is not contradictory. And I think we are much closer to the double or triple bottom line, as we call it, than we were a couple of years ago. And I think that's really exciting.
Absolutely. And you're speaking our language of social finance at the ILO. So that's great. Thank you, Nii. Okay, so I'm going to move over to Asha. So last but certainly not least, I would like to introduce our fourth speaker. So Dr. Asha Hassan is a disruptive innovator and a serial entrepreneur in the areas of digital health and financial inclusion. He is the founder and executive chairman of Naya Jivan, Pakistan's first health and wellness plan for informal and formal workers in corporate value chains, and the co-founder and executive chairman of Doctors, South Asia's first gender-inclusive telemedicine-powered digital health platform. A TED speaker, TED fellow, and MIT solver, Asha has previously served on the World Economic Forum Global Agenda Council for Social Innovation between 2012 and 2014, and is a 2011 World Economic Forum Schwab Foundation Asian Social Entrepreneur of the Year. Prior to launching Naya Jivan, Asha served in the capacity of Senior Director of US Medical Affairs for Amylin, a leading biopharmaceutical company in San Diego, California. Asha completed an MBA from New York University's Stern School of Business and conducted preclinical research at Harvard Medical School and Massachusetts General Hospital, followed by training in general surgery at Beth Israel Medical Center. A voracious reader, Asha is also fond of hurtling down alpine ski slopes, bathing in the hot springs of Iceland, and cruising in the Caribbean. So watch out next year. Bali, Rio de Janeiro, Lake Bellagio, and Istanbul are his favorite destinations for spiritual rejuvenation. I certainly like the sound of that list. So without further ado, actually, if I can just say a few words about doctors, I think it's worth it just to, so you know our doctors, and then I'll hand over to you, Asha. So Doctors is a digital health platform that matches the underutilized capacity of female doctors who otherwise would be excluded from the workforce to the unmet need of health consumers via nurse-assisted technology. And Doctors recruits, equips, and trains female frontline workers, so nurses, midwives, lady health workers, and deploys them in factories, corporate offices, clinics, and ambulances. These trusted intermediaries can perform sophisticated diagnostic and interventional procedures through AI-enabled telemedicine in real time under clinical supervision of remotely located female doctors. So Asha, I just wanted to say that. Welcome, and over to you.
Thank you, Lisa. You've pretty much given half of my presentation, so I think I'm pretty much done. No, let me share some thoughts with you. So, as you correctly pointed out, Doctors is a gender-inclusive health tech, so I don't need to belabor that. NEAG, even for those of you who are not familiar, is an inclusive insurtech. It provides access to health, life, livestock, and general insurance solutions. Next. So let me share with you a typical beneficiary of ours. This is Sophie. She's a 24-year-old female factory worker. For those of you who are familiar with football, you'll recognize that she works in a factory that supplies Adidas footballs. Pakistan happens to be one of the largest global exporter of footballs. That's all and well. She works in a technically sophisticated factory. They do have an on-site primary care clinic. That clinic is staffed by a male. Given the cultural background that Sophie comes from, she does not feel comfortable visiting a male doctor, especially for reproductive healthcare issues. She happens to be in her first trimester. She's also enrolled in a government insurance program that was designed for industrial workers. But that program, for some reason, does not include outpatient reproductive, obstetric, and gynecologic care. What that means is that basically for any type of abdominal pain or pelvic pain that should happen to her, which is quite frequent during your first trimester, she has to leave the factory, commute an hour to a government hospital, wait a few hours to see an OBGYN. By the time she's back in the factory, she's basically lost her day's wage and also elicited the wrath of her manager. This is a reality that is faced by about 6 million women across South Asia, India, Pakistan, Bangladesh, Nepal, Sri Lanka, especially in the textile and garment industry, where there are millions of women workers literally sweating away. Next. So the problem that that I just described is a problem that obviously we set out to address and tackle. And the best way we did this is we actually got a group of Sophies, factory workers, and other female workers working in corporate value chains together, and we co-created a health insurance program, a digital health and well-being program around their needs. Co-creation is so important. I want to highlight that regardless of the technology innovation that you use, being able to address the ultimate customer need and giving them a sense of ownership within that product, in the design of that product, I can't emphasize how important that is. One of the most important elements of our product or program, if you will, is on-site access to primary care delivered through telemedicine. So we have equipped nurses, upskilled nurses, equipped them with 4G connectivity and tablets, and deployed them in factories, in corporate venues, in other industrial venues, where they are able to connect workers such as Sophie to a remotely located network, a global network of remotely located doctors, both GPs, primary care physicians, as well as specialists, so that workers such as Sophie are able to get care when they need it, where they need it. In addition to that component of on-site care, we also deliver on-site pharmaceuticals. So any prescription that Sophie might need can be delivered right to the factory or to her home. Again, bringing healthcare to where the worker or beneficiary lives or where they work, where they spend most of their day. Beyond that, we of course have integrated digital financial services. We're working with partners to integrate payroll-linked financial services, loans, payday loans, etc. And perhaps what I would say is our core strength or our secret sauce is that we provide what we call a continuity of care experience. What that means is that doctors curates and navigates patients from A to Z. Every single interaction that this individual has with the health ecosystem is curated and navigated by us. What that enables is tremendous continuity of care. It also provides us access to a lot of data, which, as you can imagine, can be used in a variety of different ways, including building sophisticated AI models. Next. While we cater to all socioeconomic segments, I'm going to restrict my discussion or presentation today to the bottom two. Sophie, the factory worker, belongs to the green segment. These are mostly third-party contract workers that work in suppliers' factories that supply large Western European American retailers. The bottom segment in Pakistan is 140 million lives. These are ultra-poor community people working, living, mostly agrarian workers, people working in agri-value chains who live in rural areas or in peri-urban slums, to whom we now turn. Next. So meet the Ramchand family. The Ramchands are a part of a community of livestock herders. They live in a district called Tharparkar, which is in Sindh, in a province in Pakistan, which is just adjacent to Rajasthan. Across the border is Rajasthan, India. The Thar Desert, or the Thari Desert, straddles this entire region. And over the past decade, climate change induced severe drought has decimated the incomes and the local economy. Approximately 30% of the livestock that the Ramchands have perished due to severe drought or malnutrition. Now, the problem or the issue that we tackled was, when you have a family that has an income of maybe $40 to $60 a month, how do you provide them with a high-touch hybrid healthcare plan that costs $20 a month? This is the problem that we set out to answer or solve. Next. So the way we did this is through what I would say is business model innovation. And this is a nut that I think it took us a long time to crack, but I believe we have finally cracked this. What we do is we partner with large corporations, companies like Unilever, Friesland Campina, fast-moving consumer good companies, companies that have very large value chains across South Asia. We identify low-income, uninsured, or previously uninsured populations, vulnerable populations that are in any way accessible, linked, formally or informally, to these MNCs. For example, they might be a group of low-income sales reps that happen to be selling goods that happen to be Unilever goods, linked to distributors who are linked to Unilever. We enroll these populations, we aggregate them, we enroll them in digital health and well-being programs. And these programs are co-financed by the corporate partner and by the intermediary, usually a manufacturer or a distributor. The cost, as I mentioned earlier, is about $20 a month per family. What that does is it gives us the opportunity to deliver a very high quality health experience to these low-income customers. So Neajivan does the aggregation, Doctors does the tech-enabled health service delivery. That's how these two co-owned and co-founded companies work together. Next. There are 4 key components to our intervention. The first, of course, is that we focus on the excluded, communities that are previously uninsured. To give you some benchmarks, in Pakistan, only 1% of the population is insured. What that tells you is that 99% of the population is waiting for products and services that create a meaningful impact in their lives. This represents a massive opportunity for impact as well as for impact investors. In addition to that, we're very gung-ho about building the capacity of women. whether it's our female doctors who are remote healthcare providers, whether it's female frontline health workers who interact with our beneficiaries, or whether it's the beneficiaries themselves. And I'll give you a couple of examples later on. Primarily, we're also very interested in enabling communities to generate income. Our theory of changes is that if you enable communities to generate income, and if you give them asset protection, that combination enables them to emerge out of poverty and enter into the middle income consumer class. We've seen this happen over the years with a number of our target populations. And so we're very bullish on this particular idea about offering income generating opportunities as part of our core value proposition. And last but not least, we fully integrate digital financial services into our products and services. Next. To give you an example of how we are gender inclusive, we have, train, equip, recruit female frontline health workers. These are usually community health workers, nurses, midwives. We provide them with 4G connectivity. We equip them with tablets. We deploy them in factories, in industrial venues, in corporate offices, as well as in communities, both rural and urban slum communities. These female frontline health workers are seen as trusted intermediaries. They speak the local dialect. They are known by the beneficiaries. They live in the same communities. They are accountable to their communities, which is really important when you're offering them an intangible such as insurance. And what these female health workers do is that they digitally connect our remote network of doctors to these beneficiaries. And as some of the speakers have mentioned before, a lot of women in our part of the world are disconnected from technology. And so having a female intermediary who has access to that technology becomes vital. She becomes that vital link connecting the beneficiary to the larger health ecosystem. And so the role of these female frontline health workers is truly a linchpin role in promoting inclusiveness. Next. Now, these female frontline health workers don't just provide access to healthcare. They actually perform a number of tech-enabled services in their communities. In fact, they are seen as community resources. They provide their communities with access to digital services, to medicine, health products, medical supplies. They provide access to fast-moving consumer goods that are manufactured by a variety number of large FMCGs. And of course, they provide access to the healthcare as previously mentioned. They truly are resource access points that are digitally connecting these communities to the mainstream. Next. Here's just an example of one of our female frontline health workers who we refer to as good Dibajis or good sisters, good elder sisters, who is conducting a video consultation using her tablet. She's connected a beneficiary seated on the left, and the beneficiary is having a mental health consultation with one of our therapists. This is something which is very common in the communities that we interact with. That type of, again, trusted intermediation done by a female frontline health worker, where the beneficiary feels very comfortable sharing privileged or confidential information in front of them. They truly see them as a health resource. Next. So as I mentioned earlier, these female frontline health workers, they promote inclusiveness. And the way they do this is they leave no woman, man, or child behind. And I mean that. They actually do door-to-door visits in every community that they live in or work in. And so everybody gets screened for a variety of different diseases. And what that does is it often unmasks a lot of underdiagnosed or conditions which even sometimes the beneficiaries are not aware they had. Next. Oftentimes these issues can be psychological in nature. We've seen a lot, especially in the context of where these communities are based, that mental health can be a huge challenge. And mental health is also a taboo. It's often seen as something that should be swept under the rug in South Asia, not something that should be discussed out in the open. But these female frontline health workers promote active peer support groups. They promote the idea of women coming together, a sense of community, a sense of inclusiveness in which they can share their joys, their delights, their pains, et cetera, collectively as a group. We've seen tremendous impact as a result of this model. Next. And finally, for the health workers themselves, capacity building, as I mentioned earlier, technology-enabled capacity building is a big feature of our program. So we do a lot. In fact, we do weekly sessions, just like the ones you see on this slide, in which both our female frontline health workers, as well as our remotely located doctors participate. And the idea is to share best practices, as well as things that did not work or could have been done better. And so customer feedback is a critical part of these trainings to help enhance that customer journey. Next. So in closing, I just wanted to say that, and I think this has been mentioned earlier as well, that technology is not a silver bullet. I think it was Demetrius who used that phrase, and I really liked it, so I'm repeating it. Technology is not a silver bullet. However, it is a huge democratizer, and technology has enabled communities, families such as the Ramchans, who probably live 400 miles away from any major metropolis or major population center, to be digitally connected to the mainstream and to be able to participate in the mainstream economy. And so from that perspective, I think we've enabled them to live more dignified, more empowered, and more inclusive lives. Thank you.
Thank you so much, Asha. That was really powerful. And I just love the photos that really brought us, to the beneficiaries and some of the issues that they're facing. So thank you for that fascinating presentation. We had spoken about this before our session today, and I was just wondering, if you could share maybe, with the COVID pandemic, what has your experience been of the impacts on the population that you serve, and how has doctors managed to contribute to the solution?
So Lisa, specifically for this particular community that I just introduced you to, the Ramchand family and the community, the villages that they live in, when there was first of all, they'd never been exposed to something like this, and they'd never been forced into a situation where there was quarantine or enforced social distancing, enforced by the municipal, as well as the provincial and even the federal government. And so it provoked a lot of anxiety and a lot of stress, fear of the unknown. Now, as I mentioned earlier, these communities are herders. They're used to being outside with their livestock, especially the men who were not used to the idea of spending time with their domestic partner in what are essentially quite cramped living spaces. You can see the size of one of these huts in the background in this slide. It's basically a thatched hut, relatively small, and men, especially in our part of the world, are not used to that idea. And what it did is it created a lot of frustration amongst the men. Unfortunately, a lot of that was vented on their domestic partner. And so we saw a huge spike in two things: a huge spike in gender-based violence and a huge spike in gender-based violence associated mental health issues. So that's something, those were signals that we picked up fairly quickly. Our female frontline health workers, in fact, mentioned repeatedly to us that, this is an issue that we absolutely need to tackle, because we're seeing significant numbers of suicides happening in these communities, far more than you would normally expect. And so I think that COVID did two things. Number one is it shut down the livestock markets. Now, if your primary source of livelihood is livestock trading or herding, then that means that your primary source of livelihood has been decimated. And that was true for most of these communities. So they essentially eradicated any savings that they might have. They ended up, in many cases, relying on charity or philanthropy or government handouts. But it was a very stressful situation for them, especially for the women. Having said that, I will say that at the same time, this situation helped promote and build tremendous resilience as well. And so what we've seen is we've seen that these communities have adapted to this environmental stress, including the climate change induced stress, the drought conditions that I'd mentioned previously. So while we see these unique, what I call acute phenomena, such as a spike in gender-based violence, I'm also somewhat heartened to see that there's been much more resilience. And a lot of the women, especially thanks to our female frontline health workers, have really kind of formed these community support groups, which we find as really inclusive and powerful ways for, especially if these circles, we call them circles of trust, if these circles of trust interlock. So circles that intersect with circles that intersect with circles. And so we see that type of community building happening. I hope that answers your question.
That's fantastic. Thank you. And yeah, just thank you for this important work that you're doing. It's really inspiring. So with that, I'm afraid our session has actually come to an end. We almost exactly at our 1.5 hours. So our panelists have been amazing, I'm sure you would agree. And certainly the questions, thank you for sending your questions through the Q&A. We've been trying to answer them as we've been going along. So hopefully they've all been answered. So just a huge big thank you to our speakers. We've covered a lot of ground in this presentation. And I just wanted to end the session with one slide, one quote, just some thoughts for you to take away. With this quote, we tend to overestimate the effect of a technology in the short run and underestimate the effect in the long run. And that was said by an American futurologist called Roy Amara. And I think, we've discussed some things today that perhaps really we, in the future, we will see much more of that we don't necessarily expect today. But thank you everyone who stuck around, and I'm going to hand it back now to Dirk to close the session.
Thank you, Lisa, dear panelists, for this really interesting session. It's really a shame that we can't really continue the discussions right now and just stand together and yeah, and Asha, thank you very much for this. That's the quote of my day. Digitalization is not a silver bullet, but a huge democratizer. So it's true. It creates access for many. Some month ago, we gave a presentation at a small university in the center of Sri Lanka. We would have never gone there to give that presentation. And the students were so interested in inclusive insurance. So, and that's just great to see what digital solutions can do. So thanks to all of you for sharing your experience and your insights. Now, tomorrow is day 5. We'll be talking about solutions for the future. Now it's like the looking in the future time. As you may have seen, there is the Ensure Resilience Global Partnership Forum in parallel. Unfortunately, that happened. So we decided that we have only one common session tomorrow morning, which is called In Conversation with Our Leaders, Inclusive Insurance for Climate Risk Protection, which starts at 9:25. It's an odd time, but it's according to the time slots of the Ensure Resilience Global Partnership Forum. And after lunch, we have 2 more very interesting sessions. I think time zone wise, that is easier for the Americas to participate. It's a bit more difficult for the Asian part to participate, but that's what we could do. Take care. Have a good afternoon, good evening, good night, or a good late morning, and see you all tomorrow. And thank you so much, Lisa, for your great facilitation. Bye-bye.
Thank you. Bye-bye, everyone.
Thank you. Bye-bye.